Okay, so welcome to our presentation. The clinic that Dr. Keates and I both work at is the Center for Health Innovation. It's a health clinic that provides evidence-informed integrative medicine. It was founded by Dr. Dougal Steely over a decade ago now, and it's located in downtown Ottawa. It was previously known as the Ottawa Integrative Cancer Centre, but it's since expanded to serve both the cancer and populations and general health concerns as well. We also have a large multidisciplinary team here. We have nurse practitioners. This is Dr. Jamie in the picture there. We have yoga therapists. We have psychotherapists. We offer acupuncture, functional integrative medicine, IV therapies, massage, naturopathic medicine, and some other ones as well. The CHI also has a collaborative research arm with the Naturopathic School, and that's called the Patterson Institute for Integrative Oncology Research. So as a naturopathic doctor, I mainly focus on supporting people with cancer, mental health, and digestive concerns. Within mental health, I work with a lot of people with eating disorders and anxiety. And part of the reason I got into this profession and have such an interest in nutrition is because I myself was diagnosed with Crohn's disease, which is a form of inflammatory bowel disease, when I was young. And naturopathic medicine has helped me a lot since then. Last year, I also founded a group called the IBD Collective to support people with inflammatory bowel disease. So I do see a lot of IBD in practice, but I also work with other digestive conditions like IBS, constipation, and acid reflux. Outside of my practice, I also work part-time as a research assistant for the Patterson Institute for Integrative Oncology Research, and I'm also on the research committee for the Oncology Association of Naturopathic Physicians.
All right, good morning, everyone. I am Dr. Keates, but I think in this presentation, we're just going to go by Caitlyn and Erica. It's just much easier. I've been at the Center for Health Innovation now for about 3 years, and I've been focusing mainly in cancer care, but also women's health at the center. I'm also a part of the research team with Erica at the Patterson Institute as well, and I only work remotely at the CHI because we actually live outside Toronto in the Barrie Innisfil area. So we didn't actually move into Ottawa, and we've been kind of residing here since the pandemic. But yeah, lastly, I'm really excited to talk to you about this topic today. My personal background as Canadian national team gymnast, I never had a very good relationship with food growing up. And I think as a high performance athlete, you view food as an enemy and not necessarily as a fuel source for your optimal performance and lifestyle. So it wasn't until my education that I learned so much about the importance of a well-balanced diet. And I hope we can kind of guide you through what that is today and bring some information to you on how to get that in your lifestyle as well.
Sure. This is what we'll be talking about today. We're going to cover the foundations of a healthy diet, and that includes things like fruits and vegetables, whole grains, proteins, healthy fats, and processed foods, what a healthy plate looks like, the environmental impact of food, nutrient deficiencies, and how to have a healthy relationship with food. Today we'll be talking about food a lot, obviously, and nutrition. So with that being said, if anyone on the call or listening to the recording has an active eating disorder, then just please be mindful of the fact that this talk surrounds a lot of topics that could be triggering for some people. So first up is fruits and vegetables. As most of you are aware, fruits and veggies are one of the main food groups, and they should make up a large portion of our daily food intake. The ideal is getting a minimum of 5 servings a day. A study published in the Journal of Circulation pooled self-reported health and diet information from studies, and what they found was that people who ate just 2 servings of fruits and veggies per day compared to those eating 5, those eating 5 had a lower risk of a lot of health outcomes, including lower risk of death from any cause, heart disease or stroke, death from cancer, and from respiratory diseases. So this has kind of sparked the whole concept of 5 a day. Fruits and veggies are high in a lot of micronutrients like potassium, magnesium, and polyphenols. Some fruits and vegetables are also known for their higher fiber content, which is super important for things like blood sugar regulation, managing cholesterol levels, our digestive health, among with a lot of other things. According to the CDC, fewer than 1 in 10 US adults and adolescents actually eat enough fruits and vegetables, and it's pretty similar in Canada. Most Canadians only get half of the recommended daily amount. So this is definitely something a lot of us could work on. Fiber intake recommendations are between 25 to 38 grams per day. A big question that we often get in visits is what a serving size actually is. You're getting 5 a day, but what is a serving size? So these are some examples here. A medium-sized fruit, like an orange, would be a serving size. A cup of raw leafy vegetables, half a cup of fresh, frozen, or canned fruit and vegetables, a quarter cup of dry fruit, half a cup of veggie juice, or a quarter cup of fruit juice are all examples of what a serving size is. And if you want to learn more or see some images, you can look up the American Heart Association's serving size guide on fruit and vegetables. And they have a lot of examples and images there that are helpful.
Okay, so whole grains. Now, there's a difference between the refined grains and whole grains. Now, the refined grain is what's stripped of our most valuable nutrients. So in the refining process, they remove all of the good stuff that's in that refined grain, or sorry, in that whole grain. But the whole grain, it usually will consist of the bran, the germ, and the endosperm. So all 3 are written there. The bran is the fiber-rich outer layer. So that will supply us with things like our B vitamins, iron, copper, zinc, magnesium. It has some antioxidants and phytochemicals in there. Where the germ is the core of the seed, where the growth occurs, it's rich in healthy fats like vitamin E, vitamins, all the B vitamins, and then as well as those phytochemicals and antioxidants again. And the endosperm, which is the interior layer that holds the carbohydrates, proteins, and small amounts of those B vitamins and minerals again. The recommended daily intake is about 6 ounces of grain foods daily. So Health Canada gives us a recommended daily intake of all our fruits and vegetables, whole grains, proteins, fats, things like that. So that's the recommended intake for that. And this is based on a 2,000 calorie diet. So we're getting at least half of those or 3 ounces of that grain intake from 100% whole grains. And now when I originally think of whole grains, or a lot of my patients in that sense, they think of whole grains as kind of carbohydrates or they're bad for us. They're actually not. They actually provide us with quite a lot of beneficial or benefits to our health in general. So the bran and the fiber itself, those break down our starches into glucose, and they're really nice for a healthy blood sugar balance rather than those sharp spikes. Fiber is also a common recommendation that we have seen to lower cholesterol as well as constipation because it's able to move the waste a little bit better through our digestive tract. It's also been proven to help prevent the formation of small blood clots that can trigger heart attacks or strokes. So lots of different research studies that have been proven from a health-related perspective. One, for example, there was a longitudinal study of 160,000 women whose health and dietary habits were followed for 18 years. And they found that those who averaged 2 to 3 servings of whole grains a day were 30% less likely to have developed type 2 diabetes, which is a huge health concern here in Canada, and that we see quite frequently in practice, compared to those who did not or rarely ate a whole foods diet or whole grains diet. So that was a really neat study that was done. And some examples of grains include, or very popular ones might be spelt, barley, millet, quinoa, buckwheat, rye, oats, wild rice, things like that you might see fairly commonly, but whole grain doesn't always mean it's healthy. So that's where the confusion might be when we think of whole grains there. So if it's not listed first or second on your ingredient list, then it's probably not an actual whole grain. So looking for that when you are picking those up in your grocery stores.
Awesome. So another one of the main macronutrients that we require daily from our diet is protein. There is lots of debate on protein in the nutrition sphere. It is derived from amino acids. We have 11 that are non-essential, meaning our body can make them itself, and 9 that are essential, meaning that they must be derived from other sources like food. Protein is quite important for our muscles, our skin, our hair, our connective tissue, and some of our body's chemical messengers like enzymes, neurotransmitters, and hormones too. There are a lot of different recommendations in terms of how much protein you should get. A very common and general guideline is between 0.8 to 1.2 grams per kilogram of body weight. There are certain populations that should get more protein than others, and it does vary person to person, but some examples of these are people who are very active, so doing intense workouts, or athletes. People who are insulin sensitive or insulin resistant often respond to diets that are higher in protein a lot better. People focusing on weight loss, and also in pregnancy. Another hot topic within protein is whether you should have animal-based or plant-based proteins. Animal-based proteins mean obviously those coming from animals like beef, chicken, fish, pork, and eggs. Plant-based sources of protein are things like tofu, edamame, soy milk, most beans and legumes, nut butters, almonds, seeds. There are a lot of different options for protein sources. And for people following a mostly vegan or vegetarian-based diet, it is still possible to meet all of your protein requirements throughout the day. We just have to be a little bit more diligent when it comes to making sure that we have enough protein in each of our meals and snacks.
Okay, so this is another, I guess, food source that a lot of people have a bad rep with as well, similar to grains, but it's not the type of fat. Is more important when considering incorporating fats into your diet. So those low fat foods, they're usually filled with carbohydrates or refined grains or starches. And this is where we start to see the health concerns because those are increasing our glucose and insulin levels in the long term. So there was actually 2 studies that have shown no link between the overall percentage of calories from fat and any important health outcome, including cancer, heart disease, and weight gain. But what is important is to kind of understand what type of fat is good for you and what ones we should be avoiding. So good fats are monounsaturated and polyunsaturated fats. These are the ones that have shown to lower our disease risk. So foods high in good fats include vegetable oils such as olive oil is a very popular one that we recommend. Any nuts and seeds that Erica just kind of listed in the protein section as well, and as well as fish. Those bad fats are those trans fats. So those will increase our disease risk even when eaten in very small quantities. So foods that may contain trans fats are primarily processed foods. They are made with hydrogenated oils. So fortunately, most of these have been eliminated from a lot of our foods, but we still can see them sometimes within Canada here. And saturated fats are not as harmful as trans fats in comparison with unsaturated fats or the good fats. They negatively impact our health and are best consumed in moderation. So foods containing large amounts of saturated fats might include meat or butter, cheese, ice cream, all the good things we like there, or some plant-based options like coconut oil or palm oil also are rich in those saturated fats.
Then we have processed foods. So as Caitlyn kind of touched on with things like ice cream, highly processed foods often lack nutritional value with lower amounts of those essential macro and micronutrients. And a lot of them also have higher amounts of sodium, added sugars, and other additives and preservatives, which can be harmful to our health. A lot of research has been done on processed foods, and a good example of this is with processed meats. So higher intakes of processed meats have actually been shown to increase risk of stomach cancer and colorectal cancer, as well as other chronic diseases. And there is enough evidence supporting this now that they are classified as a group 1 carcinogen by the World Health Organization. And group 1 carcinogens are types of carcinogens that are known to cause cancer.
Okay, so here's Canada's food guide, now that we've kind of gone through all of the different foods that we can introduce onto our plate. This is the newer Canada food guide, so it was actually introduced, or one of a naturopath, or I think a few naturopaths helped to design it, which was a nice implementation into how we kind of structure our general recommendations as well. It's not perfect, of course, but for the most part here on the left-hand side of this slide, you can see how you should kind of be structuring your plate when it comes to those, half the plate being fruits and vegetables, or incorporating a lot of fruits and vegetables like we touched on in our first slide there, and then eating more protein-based foods, and they have a lot of plant-based options included in that quarter section there, and then choosing whole grains like we mentioned when we were talking about whole grains as well. So you'll see here on the side, there's 4 guidelines. Vegetables, fruits, whole grains, and protein foods should be consumed regularly. Plant-based more often when it comes to protein. Choosing those mostly unsaturated fats over the mostly saturated fats. Water being your drink of choice. And nutritious foods to consume regularly can be fresh, frozen, canned, or dried. So I know it can be fairly expensive, which is hard, or one of the downfalls about this Canada Food Guide is that it's challenging to maintain this diet or these recommendations because of the cost, but switching to more of those frozen or dried or canned options rather than fresh can sometimes be a little bit more cost effective. And then these are some other considerations they've included into the food guide here. So yeah, again, nutritious food can be the frozen, canned, or dried. They've tried to incorporate cultural preferences as well, which was one of the other downfalls to this Canada Food Guide. They didn't really take into consideration that we're a very multicultural country, and some of those cultural preferences are a little bit different than eating how this plate is broken down. They really emphasized eating foods with others to bring enjoyment, and we'll talk about that later in our presentation as well. Traditional foods improve the diet quality among Indigenous peoples. So they mentioned how the traditional foods for the Indigenous people fostered more of a enjoyable environment for them to eat in as well. And energy needs are individual and depend on a number of factors, including your physical activity level. So the Canada's Food Guide, they did incorporate a bit of a physical activity guideline within their food guide as well. So just really emphasizing that that's important too. And they're discouraging those fad diets because they can be a bit restrictive. So that's like that intermittent fasting or the keto or paleo. They really just kind of want to emphasize how this plate is designed, and how that looks is how we should be really eating for the best, most optimal health outcomes.
And on that note, with avoiding some fad diets, we have the Mediterranean diet, which is not a fad diet at all. Canada's newest food guide generally follows guidelines from the Mediterranean diet. It is one of the most well-researched and widely recommended diets in terms of its effectiveness for a lot of different health outcomes and for preventing a lot of long-term diseases too. So again, it does emphasize vegetables, fruits, beans, and legumes. As you can see in the bottom half of the pyramid, really, we have veggies taking up the base of the pyramid, fruits and beans and legumes, kind of the next tier up. So the majority are, the kind of take-home messages from the Mediterranean diet is that it is actually mostly plant-based food. As you go up the pyramid and it's getting smaller and smaller, there is a space for animal products as well as processed foods, as you can see. And I think that is an important message when it comes to things like protein. Of our sources from plant-based options, and the Mediterranean diet kind of recommends minimizing the animal products a little bit more, but still including them in your diet. There was a study comparing the Mediterranean diet and a Japanese diet to the typical Western diet, and it showed a 25 to 35% lower risk of depression. So I know we think a lot about diet helping physical health, but there is also a big connection with the food we eat and mental health as well. One of the major differences between the Mediterranean diet and the Western diet are the higher amounts of fruits and vegetables, as well as seafood and unprocessed grains. There's also lower amounts of meats, dairy, and those kind of ultra-processed foods.
Now, the environmental impact was also included in the Canada Food Guide as well, and no food production is perfect, and there's always an enormous debate about whether animal-based diets or plant-based diets have more of an impact on the environment. And I get that question very, very often in practice: is should I be eating animal-based meats, or what should I be doing as far as a plant-based diet? What is the best from an environmental impact too? And what we know thus far, and what is available, or what we have available to us, is that more of a lesser environmental impact is seen in patterns of eating higher plant-based foods and lower in animal-based foods. So the impact includes helping to conserve soil, water, and air. The plant-based diet generally requires less water and land than is needed for animal products, and they generally cause less pollution for a plant-based style of eating. So to put this in perspective, usually producing about 1 kilogram of wheat emits about 2.5 kilograms of greenhouse gases, while a single kilo of beef creates about 70 kilograms of emissions. So generally, what we know right now is that the plant-based style of eating has a bit more of a lesser environmental impact. The way our food is produced, processed, distributed, and consumed is also another environmental impact. So that is including food loss and food waste, and has an environmental impact in that way. So food waste is a contributor to landfill greenhouse gas emissions in Canada. Reducing food waste by household food manufacturers and processors, farmers and food retailers, this can all help us make better use of our natural resources and lower our greenhouse gas emissions. So just trying to do our best here to lower that, of course, because our impact here and the way we eat definitely has an environmental impact in the grand scheme of things. Also social eating. So those, just a little tidbit on this, those who eat socially more often feel happier and are more satisfied with life, not less satisfying. Social eating helps to promote that connectiveness while eating. It encourages positive emotions and is often done in a sitting, distraction-free environment with people you feel most connected to. So generally speaking, people who do eat socially have lower rates of depression, anxiety, and they have better connectivity to people within their community and to their friends and family as well. So we encourage you always to go out for dinner parties or brunch dates when you can to improve your eating habits, but also your mental health at the same time.
We're going to move on to talking about nutrient deficiencies. And there are some common ones in Canada. Vitamin D is one of them. Iron, calcium, and magnesium are kind of a big four. We're going to talk about vitamin D and iron today. Some signs and symptoms of vitamin D deficiency can go unnoticed. So some people don't realize that they're deficient until we do a blood test. And that is part of the reason why we often say, as naturopathic doctors, test, don't guess, because supplements can be harmful when they're taken unnecessarily or in excess. One of the most well-known signs of vitamin D deficiency is an increase in fractures, like with osteoporosis. Others can include bone pain, low mood, frequent colds, fatigue, poor sleep quality, and hair loss. And the low mood can be a surprising one for some people, but vitamin D has been studied with seasonal affective disorder, and sometimes supplementing it with it can improve symptoms of that too. These are some food sources of vitamin D. So some mushrooms are high in vitamin D. Eggs are a good source, as well as fish. And lastly, our lifestyle is also a way to get vitamin D. Daily recommended intakes of vitamin D are based on minimal exposure to sunlight. So our levels do change in the summertime when we can put on sunscreen, go outdoors, and increase our absorption of it. Typically, we see levels being lower in the spring, meaning like after the winter is over and we've been kind of deprived of sunlight, compared to in the fall when it's been the end of summer and we've been able to better absorb vitamin D for a few months. Next, we have iron deficiency. So iron is a mineral that our body uses to make hemoglobin. And hemoglobin is important because it helps carry oxygen throughout our whole body. Iron deficiency is more common in people who menstruate and in pregnancy because blood volume increases along with the amount of iron that our body needs. Some common signs and symptoms of iron deficiency are extreme fatigue, pale skin, shortness of breath, decreased ability to exercise, and also some symptoms like brittle nails, headaches, and dizziness. So how do we treat nutrient deficiencies? Obviously, one of the best options is through our diet. Like we said, there are a lot of different sources of foods that are high in vitamin D as well as iron. But there are sometimes when dietary sources of these nutrients aren't enough. And this is when we might consider to help support those levels. It can take several months to see improvements in nutrient status actually improving on blood work. So typically, depending on the person, we recommend something like retesting every 3 to 6 months or so. And the other piece is that sometimes there can be underlying health conditions. So in cases when you're supplementing but levels are not coming up and they're still low, sometimes it can be a sign pointing to other causes of deficiency. So you might not be absorbing the supplement or nutrients properly, or maybe not digesting them properly. And this can be common in some health conditions like inflammatory bowel disease.
All right, so now we're just going to move on to the second part of our presentation, which is how to have more of a healthy relationship with foods. Okay, so the first one is mindful eating. So I did an exercise when I was in my undergrad where a professor gave us a piece of chocolate. I'm not sure if you've ever done this before as well, but we had to close our eyes, feel the piece of chocolate in the wrapper, unwrap the chocolate, smell it before we could even taste it at all. So we were activating all of our other senses before we could even eat the chocolate like we regularly do, where we get a piece of chocolate and unwrap it as fast as we can and eat it all. Then we were allowed to place the chocolate in our mouths, but before we could even bite it, we had to let it melt for a bit, put it on either side of our mouths, kind of move it around our tongue, and then we could finally bite down and enjoy the chocolate. And honestly, by the end of that whole exercise, I did not want another piece of chocolate. One was enough to satisfy my chocolate craving. But this is kind of what a mindful activity may be, to an extreme, of course. But you can, if you find you have a bit of a lower appetite or just food doesn't taste the same anymore, try doing that with something that is very has a strong taste like a chocolate, and you can practice while eating in that sense. I always emphasize 5 S's with my patients. So sit, slow down, savor, simplify, and smile. So mindfulness eating is using all your physical and emotional senses to experience and enjoy some of the food choices you make during the day. Chewing your food, what does it taste like? What is the texture? Is it sweet, sour? Closing your eyes might be some strategies there too. Always doing it in a distraction-free environment. When we're eating, we want to be putting our phones down, turning our tablets off, no TVs, nothing to distract us other than, of course, our friends. We want to enjoy eating with company when we can and socializing and slowing down. Slow down, chew your food, slow down between courses or between bites. That's really how we can mindfully eat so that we can really amplify our taste buds and our digestion.
Awesome. So as Caitlyn said, being mindful while eating is super important. One of the things that mindful eating allows us to do is to tune into our body's hunger and fullness cues. And these cues can help us decide when to start eating, when to slow down or stop eating, and also how much we feel like we're hungry for. Are we ready for a snack? Are we ready for a meal? Some people who have a history of an eating disorder or yo-yo dieting can have a harder time knowing their body's hunger and fullness cues, either because they've been ignored for a while or they just don't trust their body the same way. One tool that we often use, both for people with eating disorders and without, is called the hunger scale. So I'm going to pause for a few seconds and ask you to get into a comfortable position. If you feel comfortable with it, you can close your eyes. Take a breath. And I want you to check in with yourself. So it's 11:39 a.m. I want you to think about when your last meal was. What does your stomach feel like? Is it growling? Are you satisfied? Are you thinking about your next meal yet? Are you waiting on breakfast or lunch? Now I want you to choose a number that represents how hungry or full you are right now on a scale from 1 to 10. So 1 being absolutely starving and 10 being the most full ever. Choose what represents where you sit. If you're comfortable with it, you can share your number in the comments and why you chose that number. The hunger scale, like I said, goes from 1 to 10, and we often use it to help people better understand their cues throughout eating disorder recovery, but also for those just wanting to be more mindful of their eating habits and prevent overeating too. Ideally, throughout the day, we want to sit somewhere between a 4 and a 7 on the hunger scale. If you chose a number outside of that, that's okay too. 4 and 7, I'll describe those two a little bit. 4 kind of feels like your hunger is awakening. You're feeling some hunger, but you haven't missed a meal or a snack yet. you might be starting to think about what to eat in the next half hour or so. 7 is often termed subtly full. So you're just past satisfied, not feeling super full yet, but subtly full. You might be just finishing a meal at a 7, and you can tell you probably won't be hungry for at least a few hours. The hunger, again, is a tool that we can use to kind of better understand our body and to make healthy food choices as well. This food pyramid here was created by the Center for Clinical Interventions in conjunction with a couple of dietitians. And it was designed for people with eating disorders, but there are some excellent takeaways from it for those who have never had an eating disorder as well. As we talk about it, though, I want you to keep in mind everyone has their own unique needs, and you may need to work with someone well-versed in nutrition to develop a plan and kind of a guide that's specific to your body. So some main takeaways of this pyramid. The largest section at the bottom here refers to most of the foods that are included in Canada's food guide. We've got proteins, we've got fruits and vegetables, we've got carbohydrates and whole grains, and we've got calcium-rich foods. So we want these foods to take up the majority of our food intake throughout the day. We also have a level higher up with nuts, oils, and fats. We still want to aim to eat these foods every day, but sometimes in smaller quantities compared to things like the fruits and vegetables. Above this, we have a section for social eating and what we call fun foods. Fun foods might be things like chocolate bars, cupcakes, lollipops, cookies, muffins, donuts, things like that. For people recovering from an eating disorder, it can be important to include these foods a little more often, in part because usually people have restricted them for a long time, and that can create an unhealthy dynamic with them. These fun foods are also sometimes called treat foods, or I like to refer to it as soul food as well. At the top of the pyramid here, this is, again, a little more specific for people with eating disorders, but we want to minimize the filler foods that we're using because they are often used to kind of fill up and make you feel full, and they do sometimes take up more space on our plate than needed and kind of push out some of the more nutritional foods, like those at the base of the pyramid. So these might be things like sugar-free sweets, excessive amounts of zero or low-calorie condiments or flavorings, or also super large servings of fruits and vegetables that kind of cause you to neglect other food groups like proteins, fats, and carbs. So these fun foods, like we mentioned, are not on Canada's food guide, but they do often show up in our diet, depending on how often you have them. Some people have dessert every day, and some people minimize it more to a couple times a week, which is okay either way. And as you can imagine, these fun foods don't always meet or fulfill our major nutritional needs, but they can help us feel happy and be a bit of that soul food. You might think of things like ice cream. If you're in Ottawa, you might be thinking of Mooshu or the Mary Dairy, or going for croissants on the weekend. And again, these fun foods are things to minimize, but definitely include throughout the day.
All right, so this takes us to just our in summary or key takeaway picture here today. So we learned a lot about the breakdown of a whole foods diet, including our fruits and vegetables, our whole grains, our proteins, and our healthy fats, and how to create a balanced plate with those nutrients there. Then we reviewed the Canadian Food Guide and the Mediterranean diet, which is Erica and my favorite diet to recommend if you're one of our patients. And we looked out for some common food deficiencies and how to watch for that and common symptoms, where we can make up for that within our diet or in our environment and what we do in our lifestyle per day. and then left off with some tips and tricks for a more positive food relationship there. And I hope you guys got some good takeaways from that today.